Obesity is a very complex medical condition and not just a simple problem of willpower or self-control. While lifestyle plays a part, hormones are also a factor. We sat down with obesity specialist and endocrinologist Dr. Manisha Sood to talk about how hormones can affect weight gain and how this knowledge can help fight obesity. Obviously, we now know that obesity is not just due to overeating.
Absolutely. Our understanding of obesity has deepened so much over recent years. Certainly calories do play a role to some degree, but that doesn't tell the whole story. And the stigma around obesity is hopefully slowly being removed as we understand that people who suffer from obesity aren't just lazy. There are hormonal factors that come into play, environmental factors, genetics. There's so many things that could contribute.
Hormones send signals throughout the body. Fat cells, your digestive system, and your brain produce many hormones that play a role in how much you eat, how much energy you burn, and how much you weigh. Your stomach, intestines, pancreas, and fat tissue use hormones to tell your brain when you're hungry or full. Because hormones help maintain energy balances in the body, hormone disorders such as hypothyroidism or Cushing's syndrome can cause overweight and obesity. What are the treatment options for those patients?
So treatment options basically are rooted in lifestyle modification, and we counsel patients about nutrition and exercise, but many people have tried that already, and classic calorie restriction is not the end-all be-all to obesity treatment. If that was the case, we wouldn't need obesity medicine specialists. So then we often go to FDA-approved weight loss medications, of which there are several on the market, and they've been around for long enough that we've improved our experience and expectations of those medications, and we understand their side effect profiles very well. And finally, some patients may be eligible for bariatric surgery or metabolic surgery for weight loss.